GLP-1 medications are being called the biggest breakthrough in weight loss history. But if you're over 60, there are serious risks nobody is warning you about right now. I'm talking about Ozempic, Wegovy, Mounjaro, Zepbound. These drugs are everywhere. Celebrities are taking them. Your neighbors are taking them. Maybe your doctor mentioned them to you. But here's what the advertisements don't tell you. These medications work differently in a 65-year-old body than they do in a 40-year-old body. Very differently. There's one specific risk for people over 60 that could permanently damage your independence. I'll reveal it later in this video, and it genuinely shocked me when I researched it. By the end of this video, you'll know exactly how these drugs work, who should consider them, who should absolutely avoid them, and what questions to ask your doctor. Everything I share today comes from published medical research, clinical trials, and guidelines from major medical organizations, not opinions, not drug company marketing. Just honest science. I'm not being paid by any pharmaceutical company. I'm not trying to sell you anything. I just want you to have complete information before making a decision about your health. Let's start with the basics. What exactly are GLP-1 medications? Because most people taking them don't really understand what they're putting into their body every week. GLP-1 stands for glucagon-like peptide 1. It's a hormone your gut naturally produces after you eat food. This hormone does several important things inside your body automatically. First, GLP-1 tells your pancreas to release insulin. Insulin helps move sugar from your blood into your cells. This keeps blood sugar levels stable after meals. Second, GLP-1 slows down gastric emptying. Food stays in your stomach longer. You feel full for hours after eating. That constant hunger feeling goes away finally. Third, and this is the big one, GLP-1 talks directly to your brain. It affects appetite centers. It literally turns down the volume on hunger signals inside your head. People on these medications describe it as food noise disappearing. They stop thinking about food constantly. Cravings diminish dramatically. Eating becomes functional rather than obsessive for them. GLP-1 medications are synthetic versions of this natural hormone, but they're much more powerful and last much longer than what your body produces naturally on its own inside you. Natural GLP-1 lasts minutes in your body. These medications last days. One weekly injection keeps drug levels steady. That's why they're so effective for weight loss. The main GLP-1 medications are Semaglutide, sold as Ozempic and Wegovy, and tirzepatide, sold as Mounjaro and Zepbound. They work similarly, but have some differences. Ozempic was approved for type 2 diabetes. Wegovy is higher dose semaglutide, approved specifically for weight loss. Same drug, different dose, different official use. Both cause significant weight loss. Mounjaro and Zepbound contain tirzepatide. This drug targets both GLP-1 receptors and GIP receptors. It may produce even more weight loss than semaglutide in some studies. Clinical trials show people lose 15 to 20% of body weight on these medications. That's dramatic. For a 200-pound person, that's 30 to 40 pounds lost. If this kind of honest health information matters to you, hit subscribe right now. I make videos like this every single week specifically for people over 60 who want truth. Now let's talk about why these medications have different risks after 60. Your body at this age is fundamentally different from a younger person's body. Risk number 1 for people over 60. Accelerated muscle loss. This is the most serious concern, and it's the one that could permanently damage your independence if you're not careful. When you lose weight on any diet or medication, you lose both fat and muscle. That's normal, but the ratio matters enormously, especially after 60, when muscle is precious. Studies show that on GLP-1 medications, 25 to 40% of weight lost can be lean muscle mass, not fat, muscle. Up to 40% of what you lose at age 35, losing some muscle, is manageable. You can rebuild it relatively easily. Your body still has anabolic capacity. Muscle recovery happens efficiently at that younger age. But after 60, you're already losing muscle naturally, every year. It's called sarcopenia. You lose 3 to 8% of muscle mass per decade after 30 years old, and that rate accelerates after 60. So now you're taking a medication that dramatically speeds up muscle loss on top of age-related muscle loss already happening naturally. Why does this matter so much? Because muscle after 60 isn't about aesthetics or looking good. It's about survival. It's about staying alive and maintaining your independence daily. Muscle protects your joints from damage. It keeps you balanced when walking. It prevents falls. It supports metabolism. It's your body's armor against aging and injury every single day. Less muscle after 60 means more falls, more fractures, longer hospital stays, loss of independence, and a significantly higher risk of dying from complications. Research proves this clearly. A hip fracture after 65 changes everything. 20 to 30% of people who fracture a hip die within 1 year. Many never walk independently again. Muscle prevents falls. This is why any person over 60 considering GLP-1 medications absolutely must have a strength training plan. Not optional. Essential. Your life may literally depend on maintaining muscle. Risk number 2. Bone density loss. Rapid weight loss from any cause can decrease bone density. The mechanical stress of body weight actually helps keep bones strong over time. Remove that weight quickly, and bones lose the stimulus they need to stay dense. For women over 60 already dealing with postmenopausal bone loss, this accelerates osteoporosis significantly. Weaker bones plus weaker muscles equals dramatically higher fracture risk. This combination is especially dangerous. Falls become more likely, and falls become more damaging when they happen. If you're considering GLP-1 medications, get a bone density scan before starting. Know your baseline. Monitor bone density during treatment. Take calcium and vitamin D supplements as recommended. Risk number 3. Gastrointestinal side effects that become dangerous. Nausea, vomiting, diarrhea, and constipation are extremely common with GLP-1 medications. Up to 70% of users experience them. For younger people, these side effects are just uncomfortable, annoying, something to push through. But for people over 60, they can become genuinely medically dangerous. Here's why this matters. Persistent vomiting and diarrhea cause dehydration. After 60, your thirst mechanism weakens. You don't feel thirsty, even when your body desperately needs water. Dehydration happens easily and quickly. Dehydration in older adults causes kidney problems, dangerous blood pressure drops, confusion that looks like dementia, electrolyte imbalances affecting heart rhythm. These can be life-threatening complications. If you're taking blood pressure medications or diuretics alongside GLP-1 drugs, the dehydration risk multiplies. These drug combinations require very careful monitoring by an experienced physician regularly. Now, if someone you love is considering these medications, share this video with them right now. This information could literally save their life. They need to know these risks before starting. Risk number 4. Gastroparesis. Stomach paralysis. This is something most people haven't heard about, but cases are being reported more frequently now, and it can be serious. GLP-1 medications work partly by slowing gastric emptying. Food stays in stomach longer, making you feel full. But in some people, the stomach slows down too much. Way too much. Gastroparesis means the stomach essentially stops moving food through properly. Food sits there for hours, sometimes days, causing severe nausea, vomiting, bloating, intense abdominal pain constantly. For older adults, this is especially dangerous because gastroparesis interferes with absorption of other medications you're taking. Blood pressure pills, heart medications, thyroid drugs, diabetes medications, everything. If your stomach isn't processing properly, your essential medications may not be absorbed correctly. They won't work as intended. This creates dangerous instability in conditions you're already managing daily. Risk number 5. Pancreatitis. Inflammation of the pancreas. This is listed as a warning on GLP-1 medications. Cases have been reported, though the exact risk level is debated. Symptoms include severe abdominal pain radiating to your back, nausea, vomiting, fever. Pancreatitis can be life-threatening, especially in older adults. It requires immediate medical attention always. If you have history of pancreatitis or gallbladder problems, you may not be a good candidate for these medications. Discuss your complete medical history with your doctor before considering them. Risk number 6. Gallbladder problems. Rapid weight loss from any cause increases risk of gallstones. GLP-1 medications cause rapid weight loss. Therefore, gallstone risk increases significantly. Gallstones can cause severe pain, infection, may require emergency surgery. Older adults have higher surgical risks generally. This is another factor to consider before starting these medications for weight loss. Risk number 7. Thyroid concerns. GLP-1 medications carry warnings about thyroid tumors. In animal studies, these drugs cause thyroid tumors in rodents. Human risk is uncertain, but concerning. If you have personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, you should not take these medications. They're contraindicated for those specific conditions. Now let's talk about the weight regain problem, because this is crucial information that affects your long-term planning. What happens when you stop taking these medications eventually? Studies show that when people stop GLP-1 medications, most regain the majority of lost weight within 1 to 2 years. The weight comes back. For most people, it comes back. A study in diabetes, obesity, and metabolism found participants regained roughly 2/3 of lost weight within 1 year of stopping. This isn't failure. This is the biology of how these drugs work. These medications suppress appetite while you take them. When you stop, your appetite returns, often stronger than before. The food noise comes back. Weight regain follows for most people. This means GLP-1 medications may be a lifetime commitment, not a temporary solution. You may need to stay on them indefinitely to maintain weight loss. That has major implications. Financial implications. These medications cost $800 to $1,500 monthly without insurance. Insurance coverage is inconsistent. Many plans don't cover them for weight loss, only for diabetes. If you need to stop due to cost or insurance changes, you'll likely regain weight. And remember the muscle loss issue. You regain weight as fat primarily, not muscle, fat. So you end up at the same weight but with less muscle and more fat than before starting. Your body composition is actually worse. This is called weight cycling. It's harmful. Before I continue, let me be clear. I'm not anti-GLP-1 medications. They can be genuinely life-changing for the right person. But that person needs complete, honest information first. Now let's talk about when GLP-1 medications might actually make sense for someone over 60, because there are legitimate situations where benefits may outweigh risks for specific people. Situation 1. You have type 2 diabetes and blood sugar is not controlled with other medications. This is what these drugs were originally designed for. The evidence here is strong. A major trial called SELECT showed semaglutide reduced cardiovascular events by 20% in high-risk patients, heart attacks, strokes, cardiovascular deaths, all reduced significantly. That's meaningful, real data. For diabetics with cardiovascular risk, the benefits may clearly outweigh the risks. These medications can save lives in this population. Your doctor can help determine if you qualify. Situation 2. You are significantly obese, BMI over 35 or 40. And that obesity is directly causing serious health problems that threaten your life right now today. Severe sleep apnea, destroying your sleep. Joint destruction, preventing any exercise. Heart failure worsened by excess weight. Mobility so limited you cannot function independently. These are serious situations. In these cases, rapid weight loss might be medically necessary, despite muscle loss risks. The immediate threats from severe obesity may outweigh the risks of medication side effects. Situation 3. You genuinely tried everything else. Real, sustained effort over months or years. Proper nutrition, regular exercise, behavioral support, medical supervision. Nothing has worked for you. Not just a few weeks of casual dieting. Genuine, prolonged effort with professional support. If that truly failed, then GLP-1 medications become a reasonable option to discuss with your doctor. But if you decide to try these medications after 60, you absolutely must do several things to protect yourself. These aren't optional suggestions. They're essential safety measures for your protection. Essential step 1. Get a DEXA scan before starting. This measures muscle mass and bone density precisely. You need to know your baseline so you can monitor what the medication does. Essential step 2. Start a structured strength training program immediately. Not tomorrow. Not next month. Before or when you start the medication. This is critical for preserving muscle mass. Work with a trainer experienced with older adults if possible. Focus on resistance exercises. Use weights or resistance bands. Train at least 3 times weekly. Make this non-negotiable in your schedule. Essential step 3. Dramatically increase protein intake. Most experts recommend 1 to 1.2 grams of protein per kilogram of body weight daily when on GLP-1 medications. For a 150-pound person, that's roughly 70 to 80 grams of protein daily. Most older adults eat far less than this normally. You'll need to prioritize protein consciously. The reduced appetite for medication makes eating enough protein harder, but it's essential. Protein gives your muscles the building blocks needed to resist breakdown during weight loss treatment. Essential step 4. Stay hydrated aggressively. Set reminders to drink water throughout day. Don't wait until you feel thirsty. Your thirst signal is unreliable after 60. Drink proactively constantly. Essential step 5. Monitor bone density during treatment. Get follow-up scans. Take calcium and vitamin D as recommended. Discuss bone-protecting medications if density drops significantly over time. Essential step 6. Have a realistic exit strategy. What happens if you need to stop? How will you maintain weight loss without medication? Discuss this with your doctor before starting treatment. Essential step 7. Report side effects promptly. Don't push through severe nausea or vomiting. Tell your doctor immediately about persistent gastrointestinal symptoms. Dose adjustments may be necessary quickly. Now let me give you alternatives to consider before jumping to medications. Things that work, that cost less, that don't carry the same risks. That should probably come first. Alternative 1. Resistance training. Strength training builds muscle, boosts metabolism, improves insulin sensitivity, helps with weight management naturally, and protects your body as you age forward. Alternative 2. Protein-focused nutrition. Higher protein intake increases satiety, reduces cravings, preserves muscle during any weight loss, supports metabolic health throughout your entire body. Alternative 3. Eliminate ultra-processed foods. These foods drive overeating through engineered addictiveness. Remove them, and appetite often naturally decreases without any medication needed at all. Alternative 4. Address sleep problems. Poor sleep increases hunger hormones, drives cravings, impairs metabolism. Fixing sleep often helps with weight management more than people realize it does. Alternative 5. Work with a registered dietitian. Personalized nutrition guidance from a professional, not generic diet advice from internet. Someone who understands your specific situation and medical history. These alternatives have no dangerous side effects. They cost far less than medications. They provide benefits beyond weight loss, and they create sustainable habits that last forever without ongoing prescriptions. Now let me talk directly to you for a moment. I understand the desperation that comes with carrying extra weight for years, feeling stuck, wanting a solution that finally works. GLP-1 medications can seem like a miracle, and for some people they genuinely are. Lives have been transformed. Health has been restored. I'm not dismissing these real positive outcomes, but miracles come with fine print, and after 60 that fine print includes risks that younger people don't face to the same degree. You deserve to know the full story. Don't make this decision based on celebrity transformations. Don't make it because your neighbor lost weight. Don't decide from desperation. Decide from information. Decide from careful consideration. Have a thorough conversation with a doctor who knows your complete medical history, who takes time to explain both benefits and risks, who has a monitoring plan if you start. If your doctor writes a prescription in 5 minutes without discussing muscle loss, bone density, hydration risks, protein needs, exercise requirements, find a better doctor. You deserve comprehensive care. Now, if this video helped you understand GLP-1 medications, I need you to do 3 things for me. They cost nothing. They take 30 seconds. They help more people. First, hit subscribe and turn on the bell notification. I post honest research-backed health content every single week, specifically for people over 60. No drug company sponsorships, no lies, just truth. Second, share this video right now with someone you love who might be considering these medications. They need this information before making a decision. This video could protect their health. Third, drop a comment below. Tell me your experience with GLP-1 medications if you've tried them. Or tell me what health topic you want covered next. I read every comment. Next week I'm covering 7 chair exercises. every person over 60 should do to build strength and prevent falls. Simple moves at home in 10 minutes daily. Don't miss it. That's it for today. No fluff, no gimmicks, no lies. Just honest truth for people over 60. Take care of yourselves out there. I'll see you next time.